I love that this program really solidifies a holistic approach to healthcare. Nurse practitioners are more holistic mindset as it is when you look at the difference in provider from, a medical versus a nursing standpoint. And we are really allowed to embrace the other side of, medicine, looking outside the box, looking at different sorts of research and different ways to intervene with patients that maybe aren't traditional. And I love that that is not only supported, but encouraged in our program. When we have our residency lab, we really see such a wide variety of different ways to treat disease processes that maybe aren't mainstream or mainline, but they're working and patients are having better outcomes. So I think that that is so important because so much of medical education is very algorithmic, I would say. You do this, you do this, you do this, and that's great and that works a lot, but sometimes it really is good to say, well, but we could pull from here and we could pull from here, and we're supported to do that, which I love. I think that, when you come to a Christian campus, although whatever denomination you celebrate, there's no discrimination with that, of course, but you do just have a like-mindedness, a camaraderie with people that you know that there is at least a spiritual aspect with the people that you're with. So I feel free to talk about my faith. I feel free to, embrace that aspect of nursing, because nursing in itself is really rooted in Christianity and Christian roots and everything that you do for people at, the base level of serving another human being. And that's embraced here. And so I kind of feel like, yeah, even taking that into clinical practice, I feel okay to tell my patients, hey, well, how's your spiritual health? Like, I feel empowered to talk to them about that because of this program and because of where we come from in this program. And it's actually really helpful for people to talk about their spirituality and what is maybe a struggle for them or what they want to work on, or I want to get back into going to church. That is something I'm going to work on, and okay, I'll see you next visit. So again, holistic model, really incorporating that spirituality, which I think is left out of a lot of other programs.